guys, welcome to my channel with me, Reswari Galuh. I'm student from Balteka Mangunwijaya. Today, I will discuss solution about COVID-19. But the first, we need to know what is COVID-19 and impact on the body. Okay, check this out, may be useful and happy watching. What is COVID-19? Coronavirus disease 2019 or severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 is a virus that attacks the respiratory syndrome. This disease caused by viral infection called COVID-19. This virus seems to be contagious and has spread globally. The outbreak was declared by the World Health Organization. COVID-19 is a pandemic globally, as it spread many countries and reporting to human transmission. What happened in your body when you contract the coronavirus? COVID-19 belongs to the beta corona genome, has shown the probably bats and rodents is infection source. COVID-19 has structure that is positive strain RNA, spike glycoprotein, hemagglutinin esterase, envelope, and protein and A protein. A person with COVID-19 sneezes to droplet into the someone else's nose or mouth, virus will enter the throat. The spike glycoprotein of the main antigen protein virus play a role in attachment and entry of the virus in host cell. The ribosome for replication new virus by making viral protein, assembling and damaging the host cell. Aerosol transmission is also possible in case of broad-based exposure to elevated aerosol concentration in close breath. COVID-19 it is sensitive to ultraviolet rays and heat. Furthermore, this virus can be effectively inactive by lipid solvents include ether 75%, ethanol, chlorine, and containing disinfectant. In Indonesia, COVID-19 has infection 13,000 people and the death rate of 943 people. How to clinical manifestation of COVID-19? Clinical manifestation of COVID-19 varies from symptomatic and asymptomatic. The main symptomatic of COVID-19 they are fever, high temperature, 38 degrees Celsius, to cough and difficulty breathing. If can be accompanied fatigue, nausea, gastrointestinal and respiratory syndrome. Who is more susceptible to COVID-19? Symptoms appear 7 to 14 days after infection. Most patients have a good prognosis and small percentage in critical condition even death. Of note, the total case primarily elderly patient and approximately half in critical patient affected by persisting comorbidities such as diabetes, hypertension, cardiovascular disease, and respiratory syndrome. When does someone must check COVID-19? Someone must check laboratory if 1. Experience of symptom COVID-19, 2. Contact with patient, confirm symptom of COVID-19, 3. Have a history traveling on infected area, 4. Work in health facility relate to patient confirmed COVID-19, and 5. has a contact with animal infection.
How is medical handling related to COVID-19?
To detect COVID-19 infection, using various examination include 1. Rapid test. For the quickly filter test on COVID-19, using a blood sample, then check with a rapid test. It has a principal presence of recipient antibodies produced by COVID-19. A rapid test has a 80% sensitivity to PCR-RT. World Health Organization recommendation collection specimen from upper respiratory tracking such as nasopharynx and oropharynx sample, and the lower respiratory tract such as sputum and endotracheal aspirate. Then collection of lower respiratory sample should only be performed mechanically ventilated. Patients seem to remain positively for more extending period. The sample required storage at 4 degrees Celsius. The laboratory amplification of the genetic material extraction from saliva or mucus sample proved a reversal polymerase chain reaction or RT-PCR, which involved the synthesis of double-strand DNA molecule from RNA mold. And 3 supporting examination include a radiology examination, blood chemistry examination, microorganism examination, and sensitivity test airway material, and bronchoscopy.
Where countries are developing active vaccine?
Vaccines are divided into 2 categories, such as active vaccine and passive vaccine. If active vaccine is a virus that is weakened and only genetic material to stimulate in the body of formation of antibodies, must eliminate harmful genes without losing the housekeeping genes. Active vaccines are being developed by China, USA, Australia, and Iran. To test an active vaccine takes quite as long, around months to years.
Passive vaccine for COVID-19.
If vaccine passive is a gift of antibodies to someone through plasma donor. The passive vaccine drug have when become COVID-19, especially through potential use serum or plasma collected from those who have previously recovered from COVID-19. Give on antibodies from blood of people who have recovered COVID-19 to people actively sick and prevent complication and speed recovery. Passive vaccine that is provide immediate protection, but vaccine passive does not last as long as active vaccine and loses inactively in few weeks to months. The research proven in Germany, the same study found that is 5 critical conditions with COVID-19 convalescent plasma treatment result in improved clinical status. To apply convalescent serum administration to COVID-19, following 6 conditions must be met. 1. Availability of a recovering donation population from this disease and contribution of recovering serum. 2. Blood banking facilities from process donation. 3. Available on tests include serology tests to detect the COVID-19 in serum and virological tests to measure virus neutralization. 4. Virological laboratory support to carry out these tests. 5. Prophylactic and therapeutic protocol. And 6. Compliance with regulation, including review approval. However, the use convalescent serum can give risks that occur is a acute lung injury or trauma, and the blood type must be accordance with the donor and the recipients. The convalescent serum is recommendation for patient who is susceptible to COVID-19 based on the history of their therapy is safe to use.
Presentation of COVID-19.
Presentation of COVID-19, the World Health Organization and other organizations have issued following general recommendation include 1. Avoid close contact with subjects suffering with acute respiratory infection. 2. Unprotectable contact with from or wild animals. 3. Wash your hands frequently, especially after contact with infected people or their environment. 4. People with symptoms acute respiratory infection should they keep their distance, cover jokes or sneezes with disposable tissue or cloths, and wash your hand. 5. Wear the mask if forced the house and when the jokes or sneezes. And 6. Stay at home, stay physical distancing and social distancing, and obey the government rules. After me review of COVID-19, I hope you obey the government rules, stay at home, stay social distancing and stay physical distancing to love yourself and love your family so as not to become infection and infectious. Stay healthy and stay safe. Thanks for watching my video. See you in the next video.